Welcome to today's webinar, Pedestrian Infrastructure Safety and Health, hosted by the Maryland Department of Planning with the Maryland Department of Transportation and our many other Walktober partners. My name is Michael Bayer. I'm the Manager of Infrastructure and Development at the Maryland Department of Planning and host of the Walktober Walkinar series. Walking is an activity that many of us take for granted, but as pedestrian accident rates continue to rise and access to safe pedestrian spaces is diminished, communities are recognizing that walking and improving the walkability of our neighborhoods requires public attention and action. Throughout October, the Maryland Department of Transportation, in coordination with several state agencies and other partners, is sponsoring a series of webinars or walkinars to highlight how we can collectively rally around walking, an activity that is both central to the state's active transportation efforts and a critical component promoting public well-being. This is the second in the series. Thank you for joining us today, and please visit www.mdot.maryland.gov/Walktober for more information about Walktober and to register for our other walkinars that we'll be presenting this month. We are recording this webinar and we'll be posting it online. All participants today will receive an email with a link to the recording once it is posted. The Maryland Department of Planning also hosts the national webinar series in association with the Smart Growth Network on smart growth and planning topics available for viewing at smartgrowth.org. We encourage you to visit the website and to subscribe to our e-newsletter for smart growth and planning news and to learn about our upcoming webinars. You can also find out about planning initiatives, planning tools, and educational opportunities in Maryland by visiting the Maryland Department of Planning's website at planning.maryland.gov. Viewers of this live event are eligible to receive 1.5 CM credits from the American Planning Association. To log your AICP credits, visit the American Planning Association's website at planning.org, log into your account, and search for the name of today's event, which is Pedestrian Infrastructure Safety and Health. The APA AICP CM site is currently down, so we'll be sending out the AICP CM number to all participants in a follow-up email. So to get started, our speakers today are Dr. Olubukola or Buki, Alonge, Kandese Holford, and Jeff Dunckel. Dr. Alonge is the Program Team Manager for the Center for Chronic Disease Prevention and Control at the Maryland Department of Health. In this role, she oversees several federal grants. Her expertise as a physician and her many years of work with the State Office of Minority Health and Health Disparities provides her with the skill set to lead several chronic disease prevention and management programs. Dr. Alonge has a medical degree from the University of Ibadan in Nigeria, West Africa, and holds a master's in public health degree from Morgan State University. She resides in White Marsh with her husband and 2 children. Kandese Holford is an urban planner who began her career at MDOT SHA in 2017. As the regional planner for Montgomery and Frederick counties, Kandese serves primarily in the Office of Planning and Preliminary Engineering's Regional and Intermodal Planning Division as the MDOT SHA liaison to Northern Washington, D.C. regions, local governments, including municipal, county, and regional jurisdictions, as well as other governmental agencies, business, civic, and community organizations, elected officials, and the general public. Kandese is also leading the context-driven team in planning and implementation efforts to deliver MDOT SHA's first pedestrian safety action plan, which will focus on safety for all users. Finally, Jeff Dunckel joined the Maryland Highway Safety Office in 2017 as their Pedestrian and Bicycle Safety Program Manager. Prior to this, he served as the Pedestrian Safety Coordinator for Montgomery County, Maryland's Department of Transportation, where he led the county's implementation of its Pedestrian Safety Initiative, a strategic plan aimed at reducing pedestrian and bicycle crashes in the county. Implementation of the initiative's 7 strategies that targeted engineering, education, and enforcement countermeasures at high crash locations in areas of heavy pedestrian and bicycle activity successfully reduced pedestrian fatalities in Montgomery County by more than 30% between 2007 and 2017, a time in which national pedestrian fatalities increased by 35%. Jeff has brought his experience in reducing pedestrian bicycle fatalities and serious injury collisions to the Maryland Department of Transportation and the Maryland Highway Safety Office as they work to achieve 0 deaths implementing Maryland's Strategic Highway Safety Plan. Following their presentations, our panelists will answer questions as time permits. You can submit a question anytime by using the questions tool in the control panel located on the right side of your screen. And before we get started, we'd like to share a brief video from MDOT Secretary Greg Slater.
Hello. Today we're holding the second in our series of Walkinars for Walktober, Maryland's month-long focus on walking and walkability. You can learn more about Walktober and check out resources, events, and more at our website, mdot.maryland.gov/Walktober. Our Walkinar today is particularly significant to me personally and professionally. It's a focus on pedestrian infrastructure, safety, and health. Pedestrian safety is a critical issue across our country. In fact, the National Highway Traffic Safety Administration has declared October Pedestrian Safety Month. It's tragic and unacceptable that there were 6,283 pedestrians killed in traffic crashes across the United States in 2018. That's a death almost every hour and a half, and rates have increased in recent years. As a community, we can do something about this. MDOT is working diligently and partnering with groups, agencies, and local governments across the state to end these needless tragedies. Today, members of the Maryland Highway Safety Office and MDOT's State Highway Administration will discuss pedestrian safety issues and some of the initiatives we're taking in Maryland to address them. We're also proud to present the great work of our partners at the Maryland Department of Health, who will discuss the tremendous benefits of walking. Whether you're driving, biking, or walking, remember that we all share the responsibility to support safe walking. At some point in every journey, everyone is a pedestrian. Thank you and walk safe.
Thanks for sharing that video, John. If anyone has trouble viewing any of the videos or audio, you may need to refresh your screen today. So with that, I'm going to turn it over to Dr. Alonge.
Thank you, and thank you, Michael, for the introduction. And I would like to appreciate the Maryland Department of Transportation for the opportunity to present today, and thank everyone for joining us on this webinar. So I will start by, as I've already been introduced, Dr. Alonge, and I work with the Center for Chronic Disease Prevention and Control at the Maryland Department of Health. On this current slide, you would see the mission and vision of the Prevention and Health Promotion Administration. And the mission is to protect, promote, and improve the health and well-being of all Marylanders and their families through provision of public health leadership and through community-based public health efforts in partnership with local health departments, providers, community-based organizations, public and private sector agencies, giving special attention to at-risk and vulnerable populations. And the vision is a future in which all Marylanders and their families enjoy optimal health and well-being. And what I will be presenting on today is the health benefits of physical activity. Walking is what we are concentrating on. But like we all know, there are several types of physical activity. However, we've chosen to talk about walking, and the points around that will be shown as we proceed with the slides. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of a disease. It's important to put that in perspective because health is not just about if we feel okay, but it's not just merely the absence of disease. And it's important to know that there are several factors that affect health, right? And some of them we can modify, some of them we cannot modify. If something is related to genetics, for example, we might not be able to modify that. However, there are things that are dependent on other factors like physical activity, like the environment, like policies, and things of that nature, and those ones we can absolutely modify. The learning objective for this section of the webinar is to recognize walking as a form of physical activity, to understand the health benefits of walking, to identify walking initiatives from the Center for Chronic Disease Prevention and Control at the Maryland Department of Health. The current slide that is being shown, it reflects the physical activity guidelines for Americans. And this is the second edition. You can see the link as well as a picture on this particular slide. The second edition is the most up-to-date version, and there are several recommendations for different populations. Highlighted on the screen are the recommendations for adults as well as children. And we see from here that at least 150 minutes of moderate intensity physical activity or 75 minutes of vigorous intensity aerobic physical activity should be completed by all adults weekly. For children, it's recommended that 60 minutes or more should of various engaging activities that help kids to move is a recommendation. There is a recommendation for people that are in the much older population, the elderly, as well as even for pregnant women. No matter what phase of life we're in, we can all exercise. There is something for everyone, and there is a recommendation. It was found in a study that was done by the Surgeon General, it was found that only half of the adults in the United States exercise based on the recommendation, and even about a quarter of high school students meet the guidelines of the recommended amount of physical activity that is expected, which led to the writing of the Step It Up, which is the Surgeon General call to action. And the goal of this document is to increase walking by working together to increase access to safe and convenient places to walk and wheelchair rule, and to create a culture which supports walking for all Americans. And the question could be that why is it walking that is the recommendation? Like I said, any physical activity, once you get moving, you cycle, you swim, you do, there's so many types of physical activities that one could engage in. But walking, the reason why walking is recommended is for a few reasons that I'll get to in the next slide. This slide was put here because even in Maryland as a state, the governor and the state has recognized walking as the official state exercise. And on this slide, you see the proclamation that was given, that was signed by the governor as well as the lieutenant governor, declaring October 7 as Walk Maryland Day. And on the right side on the slide as well, you see the logo that is being used across the state for Walk Maryland. All the Walkinars, MDOT has been using it. Other partners across the state are also using the same logo. The Maryland Department of Health also uses this logo as well. So, like I said before, why walking? Why are we recommending walking if there are so many diverse types of physical activity exercises that one could take? And the first reason is that walking is free, right? Anybody can walk. And as you saw in the Step It Up document, it even talks about providing, making sure that they are wheelchair accessible, and making sure that there are routes that every population can take is accessible and available to all people. So you see here, it's because walking is free. It does not require any special skills, and it is modifiable, just like I talked about, for all populations. It doesn't require you paying for a gym membership or any expensive equipment, and it has several proven health benefits. And on the next slide, I would showcase a few of the different benefits that one could get from walking. And this you could find on the CDC website, and the link has been placed there as well. It talks about the benefits of walking. If you want to lose weight, walking is a way to go. If you want to maintain the weight loss that you've already experienced, walking is also the way to go. It also helps to control and to prevent several chronic diseases. Like we know, nationally, and Maryland is not an exception, the rate of diabetes and the rate of cardiovascular disease, the rate of hypercholesterolemia, the cholesterol range for individuals across the state is rising. And a lot has to do with the way we live, the diet, and the fact that many Americans live a sedentary lifestyle. So walking also helps to reduce the risk of high blood pressure, developing high blood pressure, or even maintaining and preventing complications as well. It also reduces the risk of type 2 diabetes, heart disease, stroke, and several forms of cancer. So it's not just for people that are diabetic, but even those who are pre-diabetic or even anyone that has not been diagnosed, you can prevent the rate or the likelihood of you developing these diseases. Some people say, well, I do have a family history, so I am going to get the condition, but that is not the case all the time. There are things that we could do to also prevent that. So walking is the way to go with that. It reduces arthritis pain and the associated disability that comes with arthritis. It reduces the risk for osteoporosis, which is a condition that causes people to have fragile bones and are predisposed to having fractures, and also reduces the risk of falls. Reduces the symptoms of depression and anxiety. If you've taken a walk on a day when it's bright and shining, the birds are chirping, and you can just go into nature, you see how it makes you feel. So just on the same way, it's been proven to reduce the symptoms of depression and anxiety. So next, I will talk about a few initiatives that are the Center for Chronic Disease Prevention and Control at the Maryland Department of Health support. One is there is a Health and Wellness Council for the state of Maryland, and one of the committees on this is the Fitness Committee. And what they do is to advise the council and to support the state in all efforts as related to physical activity, walking being one of the things, like I've mentioned. Definitely everywhere we go, we're speaking to the fact that everyone should get at least 150 minutes of moderate intensity physical activity. And the Fitness Committee is a champion on behalf of the department for all Marylanders, talking about how to increase and put that information out there. And we know, and I would like to mention one thing with the current situation we're all in as a nation and even internationally with the COVID pandemic. The COVID pandemic, with the restrictions of social distancing, the face mask and everything, walking is one thing that you can do, because outside there's so much space and you can absolutely social distance. And whenever social distancing is not possible, you can absolutely use your mask as well. So let this pandemic not be an opportunity for us to see increased rates of these conditions when we can walk. So those are part of the efforts of the Fitness Committee. Another thing that I've put here is the Walk Maryland Planning Committee. And I would like at this moment to appreciate every partner that has worked together with the Maryland Department of Health, including MDOT, who is the one who has put together this webinar today, and all the other partners. This is a committee that has been meeting year-long, right from January up till the point when the Walk Maryland Day took place on October 7th. So this is a committee where people come together just to determine how we can support the celebration of the Walk Maryland Day, which was on October 7th. So we thank all our partners. And other evidence-based programs that we also support, and there are so many of them. And here I have the Safe Routes to School program. And the Safe Route to School is an approach that provides walking and biking to school through infrastructure, improvements, enforcement and tools and incentives to encourage walking and bicycling. So ultimately, this is a program that supports students and provides accessible routes for them to walk or bike to school. Essentially, that's what it is. And right now, the center supports programs in 3 counties across the state. Another is the Evidence-Based Diabetes Prevention Program, which is a program that is targeted at people that have pre-diabetes, which is a condition where the HbA1c, which is the hemoglobin A1c, which is a test of your blood sugar control. For these individuals, they are not yet in the diabetic range, and you can prevent the progression to diabetes by just instituting some different modalities, part of which is diet, management, as well as physical activity. So that is an evidence-based program that the center also supports. And the chronic disease self-management program, which is for all chronic diseases, including the high blood pressure, as well as other chronic diseases. And another program that the center supports is the NICPAD's Inclusive Community Implementation Process. And we're actually implementing this in 2 local health departments in the state. And the purpose of this program is to integrate individuals with disabilities in evidence-based programs. Because as we know, everyone, just like the Surgeon General had said, everyone is able to walk no matter the situation, no matter where you are. We should all be able to access pathways and places by which we can walk. And that's what the NICE is all about. And this is just a slide that says that is being promoted by NICPAD, and it's called the How I Walk campaign. And this is just also to support the fact that even with a disability, you should definitely be able to walk with accessible, wheelchair accessible pathways and things of that nature. And I think that brings me to the end of my presentation. I thank you for listening. And on the slide are my contact details. And if anybody would like to reach out to the department with any questions, by all means, please do send me an email. And now I'd like to turn it over to Jeff. Thank you for this opportunity.
Actually, before we Jeff start, we're going to run a quick poll here of the audience just to see who's with us today. So you should have on your screen the question: I'm attending today's Walkinar as a planner, health professional, elected official, walk advocate or enthusiast, or architect or engineer. And if you're having trouble actually voting in the poll, you may need to exit from full screen mode so that you can access the options. So we'll give everybody a few seconds to respond. Folks are responding today. So, and as soon as we're done with this, we'll turn it over to Jeff. Give you a few more seconds to respond, about have already. So thank you, and thanks for everybody participating today. Okay, so in our audience, we have 60% of us are planners, 21% walk advocates or enthusiasts. We have 9% health professionals or healthcare workers, 9% architects and engineers, and a few 1% elected officials. So with that, we'll go ahead and turn it over to Jeff.
Okay, great. Well, thanks so much. And Dr. Alonge, really appreciate you setting the tone for how important walking is to health. And I'm here today that I'm going to be talking about how we need to be doing that safely. And because as we walk all about, especially in these times of COVID, you know, we find that we're on the streets and we're sharing that with traffic. So let me go ahead and share my screen here. And let's see here. Okay, people can see my screen.
Yes, you're up. Just put it in presentation mode. There you go.
Yep, there we go. Okay, we're good to go. Okay, well, thank you so much. I won't, just to say that I've been here with the state Maryland Highway Safety Office for 3 years, and I'm really excited to be here to talk to you all today about the programs in Maryland that we're engaged in, and the leadership of Greg Slater of making pedestrian safety and bicycle safety a priority as one of our modes of transportation. And I'm really pleased to be part of the working diligently on this. And one of my colleagues, Kandese, will be talking shortly about some of the great work SHA is doing. So thanks so much for letting me talk today. I want to start by basically touching base on who the Maryland Highway Safety Office is. We're the office that focuses on safety primarily through behavioral change, and we do this through grants and managing grants with our partners with the National Highway Traffic Safety Administration, and we focus on education and enforcement. We are about the behavior change through teaching people how to be safe, and enforcement, getting the police to enforce the laws that that keep everybody safe. And we do that coming together through a strategic highway safety plan. Previously, when I was with Montgomery County, I'd worked closely with the Highway Safety Office as one of their local partners. And I know the importance of these partnerships and pulling together everybody throughout the state and trying to figure out how we can be safer. And one of the emphasis areas, we have 6. You can see on the left side there, that column, we have impaired driving, distracted driving, aggressive driving, occupant protection, i.e. seatbelts. And then pedestrian and bicycles is actually one of the key emphasis areas because it comprises many of our crashes. And we also do a lot of work supporting all of our programs in the state with analysis of data and traffic crash reports. And also most recently, Vision Zero. I want to say that Dr. Tim Kearns, our director, is the Vision Zero coordinator who is basically ushering in a movement towards achieving 0 traffic deaths in the state of Maryland by 2030. And how we're going to do that is by focusing on a strategic highway safety plan that we do this every 5 years. The current plan, we're in the final year of that plan and about ready to come up with a new plan that will be issued this winter. But the goal is to ensure safe, secure, resilient transportation systems for everybody, for all road users, including the vulnerable ones, reducing the number of lives lost and injuries sustained on Maryland roadways, and most importantly, building partnerships to implement strategies and to strengthen our state and local efforts in a holistic way, in an integrated way, in a complementary way with all of our partners throughout the state. And we do this, many of you have heard about the 4 E's of traffic safety. And I want to point out here that engineering here is at the bottom, not because it's the least important, but probably because it's the most important. It is the foundation upon which all else is set. The engineering component, it's been said that is about 60% of the safety improvements that we've achieved over the years, and by far it's a very, very important part of what we are about, and one of the reasons we're going to be talking about that in the next presentation with Kandese. But then we focus in the Highway Safety Office on the enforcement and education. Two of those programs through grants, as well as emergency medical services. This is when, if we do a really great job on the 3 E's here on the left, we basically won't have to have as much reliance upon emergency medical services, but we know that invariably people will be hit, and we need to make sure that that they are treated and we're able to save lives by preventing fatalities and serious injuries from occurring. So these are the 4 E's of traffic safety upon which we built our program. And I want to say that I'm here today to basically refute and bring some good news about 2 common misperceptions about pedestrian safety. One is that we're not really sure, what exactly is causing these crashes, and there's uncertainty, and it's not clear, what can be done to improve them. And secondarily, there's nothing we can really do to reduce the numbers of crashes, because in fact we can, and we have, and we know that it does work when you bring these 4 E's to bear on specific locations and areas, as they've done in Montgomery County. This is a table that shows essentially the crashes that occurred and what they are now calling their high injury areas, those locations where they've had a high concentration. As you can see here in this table, we've had, some of these as many as 9, 8, 6 crashes happening in these sections of roadway, maybe half a mile, quarter mile to half a mile in distance. And what we began doing in Montgomery County back in 2008 in implementing their initiative was to do what we called safety audits, or pedestrian road safety audits, where we would go out with a multidisciplinary team and look at the issues that were seen to be leading to these crashes occurring, come up with a series of engineering treatments that could be done, and then follow that with education and enforcement actions on those corridors where we're making the pedestrian safety improvements. And you can see that essentially the results of that is pretty significant. We've, at almost every location except one, we have had a sustained reduction of the number of crashes that occurred. And this gives us hope that we actually can do something to eliminate and eventually get to zero pedestrian, fatalities, by putting these targeted efforts, on specific locations. And this technique is working throughout this is our traffic fatalities in the state of Maryland over the years. And you can see there's been a pretty impressive decline that has occurred essentially since the 60s and 70s. A little bit right now, we're trying to get a new direction downward, but the point is that we have significantly dropped these crashes from the highs of the 60s, which is when traffic safety became such a major focus with NHTSA. However, it is true that, as Greg Slater mentioned in his opening, that we do have the numbers going the wrong direction here in Maryland, or we have. And for essentially the last 3 years of data, we were in an upward direction. And we're hopeful that this last year, 2019, we actually saw a slight decline. But when you put that in a 10-year framework, we essentially average about 111 pedestrian fatalities a year. And you can see we're a little higher in these last 3 years than we would like to be. But the reality is that that's almost a quarter of the number of total traffic fatalities. In the second line down here, this last year was 23.4% of our total traffic fatalities were pedestrians, which is a big reason why we are focusing on this issue, and it is an emphasis area in our plan. When we look at bicycles, the other key component of our vulnerable road users, very concerning back in 2016 when we were going up. There seemed to be an upward cycle. We're back down to close to our 10-year average. We were real pleased in 2018 that we dropped to 6, and we had 10 fatalities. It went up, so that was concerning. And it looks like right now we're about at the same number for this 2020 period as we were last year. So we're sort of in the average number of crashes, 8 to 10 bicycle fatalities, and that's again about a little less than 2% of the total traffic crashes. But the good news and bad news on these crashes is that they are happening in, the bad news is they're happening at all. But the good news is that the areas that they're happening are sort of concentrated in an area that we can target, as we've done in previous, I previously spoke about in Montgomery County. If we can target locations where we can try to make improvements, we're hopeful and we expect that we will be able to see some significant reductions. When we look at fatalities on the right side here, you can see that 72% of these fatal fatalities that are happening in the state are happening essentially in our urbanized counties in the Washington and Baltimore metropolitan areas. We got Prince George's County, Baltimore County, Baltimore City, Montgomery, and Anne Arundel. And similarly, when we look at just all crashes, those are in the same jurisdictions. So essentially, this is occurring in those areas that are around the urbanized 2 major urban centers that we have in the state of Maryland. And when we look at the Baltimore region, we can see that we're averaging, we're up there around in the 60s right now. Again, we had a slight decline last year. And then in the Washington metro area, this is comprised of Montgomery, Prince George's, Charles, and Frederick counties. You can see that we are, kind of flat this last 3 years. So we need to be turning this around the other direction. Another important factor about where these crashes are occurring and enabling us to focus is that the fatal crashes are occurring primarily on our major thoroughfares. As you can see in this slide, the teal colored portion of this graph is showing us that a large percentage of these crashes, in fact, 65% of them are happening on interstates, U.S. highways, Maryland roads, major arterials, as opposed to 34% are occurring on the local municipal roadways, though some of those can be arterial as well. But the point is that all the way last year was in 2018, it was actually up to almost 87+%. So this means that these major thoroughfares are where these fatalities are occurring and where we want to focus to address reducing fatalities. However, when we look at all crashes, which is very important for us to be focusing not just on fatal crashes, but all crashes. And in so doing, we can eliminate fatalities. You can see that over almost 60% of those crashes are occurring on the local roadways. And this emphasizes how important it is for us to be able to build partnerships with local strategic highway safety plans are now being developed with a lot of these localities. And most importantly, we need to be able to share location-specific crash data that is housed with SHA and the state police with our local jurisdictions to enable them to experience the same success that Montgomery County did by targeting efforts on improving those areas where crashes are occurring and putting in engineering and improvements with education and enforcement. And in so doing, we will be able to drive down the numbers of crashes occurring. I want to change from where these are occurring to who is this occurring, who's involved in these pedestrian crashes. When we look at fatalities, interesting to me, I just crossed the 60-year-old threshold. I saw that my previous demographic age group in the 50s was actually the most lethal group in terms of their demographic. This is the percentage of fatalities that are occurring within each of these different age groups. And you can see the red line here is actually indicating what the percentage of that population demographic is in the state of Maryland. So clearly, we have 50-somethings are overrepresented in this, a little bit to the 20-somethings and a little bit to 60-somethings. However, when we look at all crashes, interestingly, we actually find that that the younger groups are really the ones that are overrepresented in the total crashes. So this means that we need to be focusing on younger groups and in terms of education and enforcement in terms of eliminating these crashes, and that with the older groups we're going to be focusing on what are the fatal crashes and what are the circumstances there that are leading to those increase of crashes. One of the common misperceptions and one of the conventional wisdoms 10, 15 years ago was that pedestrians were always at fault or most often at fault in these pedestrian traffic crashes. And in fact, what we actually know when we look at all these crashes is that it's actually the drivers who are most often at fault. And in this graph here, you can see that when we take this essentially what is a 6-year window here, the drivers are at fault 46% of the time, as opposed to pedestrians being at fault 33% of the time. And that's significant because that means that we need to be focusing our education efforts on drivers. Yes, it's important that pedestrians are behaving in a safe manner on the roads, but it's also critical that drivers understand the role they play in preventing these crashes from occurring. And that leads us to what is I'm going to be wrapping up here with a quick summary of our strategy and approach here with our 2 campaigns that we've targeted on our metropolitan areas where most of the crashes are occurring. The 2 strategies we're employing right now is to develop a comprehensive outreach education campaign for the Baltimore and the Washington region, and combining that with enhanced enforcement actions. And we're doing that through conducting training of police officers on best management practices for enforcing pedestrian safety laws. And I want to now share with you our campaigns in both of these municipal areas. The first one is Look Alive, which is in the Baltimore metropolitan area, being managed by the Baltimore Metropolitan Council. Okay, and if you could start that video there, Michael.
Ladies, no texting and crossing. Hey, big guy, you might be tall, but you're no match for that van. Exercise is great, but it only works if you're alive.
I got a meeting.
Oh, you got a pulse too. That's more important, right? No doubt. Thank you for always stopping for pedestrians when they cross. Nice helmet. Who are you anyway? I'm Signal Woman. That's me.
Over a year ago now, and we've been leveraging it for lots of effect through social media and digital media venues. And I'm hoping that some of you in the audience today have seen this. And it basically, what it does is it personifies the walk icon with Signal Woman. who is the woman who wants to come down and tell all the pedestrians, drivers, and bicyclists how to be safe using the roads together, and to try to bring a bit of consciousness of that it can be a place where you need to be extra cautious so we can be safe when we're walking for good health reasons. So we have a series of messages that were targeted in this last round towards pedestrians, because this was sort of the first campaign in Baltimore in some time that had been rolled out. And so we're sort of focusing a little bit on the pedestrians, more of a target. We had intended to do a second video of the focusing on drivers, and unfortunately with COVID, we've been unable to do that. So, okay, so I need to go back to showing my screen there. Yes. Can everybody's, okay, I guess we're good. Okay. Let's see if I can. Okay.
Good.
We're good. Okay, super. Okay. Still trying to learn how to use all these technologies here. Okay. Yeah, the next campaign I'm going to describe is the one that had rolled out a number of years ago. Actually, it's been about 18 years that Street Smart has been active in the Washington region. And this latest campaign with Street Smart focuses on fragility of life, and the idea, we call it our shattered lives campaign. The idea being is that vulnerable road users, pedestrians and bicyclists, are fragile, and we need to be especially cautious in protecting them, and that means looking out for them. And so a lot of the campaign messaging on this is actually targeting drivers. And we did this through trying to raise people's awareness of the consequences of dangerous actions, and making a little bit of social norming, trying to get folks to care about others. So if we could get video 2 there.
I was told that Georgette went to a convenience store directly across the street from our house. She was struck by a SUV and passed away. That connection that we have or had, that takes a lifetime to find.
Those are particularly difficult spots to produce. We had a series of 3 of them last year, and then we have expanded that this year by trying to draw in a series of testimonials from not just the 3 people that we initially interviewed, but others. And what we're trying to do is we're trying to place a sense of caring on drivers' parts, as well as pedestrians and others, to try to be protective and care about other people. And October is, as we pointed out, is Pedestrian Safety Month. For the first time, NHTSA has created this focus period for pedestrians. And so we launched that campaign, for the current campaign, on the 5th of October. So, and as I said, we're collecting a series of testimonials from people who are involved, and it's been amazing how many people have come forward and wanted their story to be part of our testimonial to share with others, to help make others safer. And what we've done is we've compiled those in a what we're calling our testimonial wall, which is traveling around right now. It's really difficult. This is a pre-COVID picture of our last press event we were able to actually have. And when we launched this campaign last year, and we're expanding the campaign this year through virtual means, and traveling around with this display that people can see and be social distance while they're observing and listening to people's stories about the impacts that crashes and fatalities in their family have had. We are also able to do a series of events with our virtual reality car, which is basically a gaming tech app that we put together to teach people how to drive safely in scenarios on the roadway where they're encountering pedestrians and bicycles. And this had a great reception. We also, last time appeared was March 3rd at the Baltimore Health Expo. So anyway, the point is that we've had to suspend this during the current COVID situation. But what's important is when we have these education campaigns is that we need to couple it with the enforcement. And so we really want to thank and call out to the Baltimore County Police Training Academy here with Frank Enko and Jason Keller. They've done a fabulous job of pulling together a training program. We've been putting about 25 police officers through this training, every 2 or 3 months. And we just did a virtual online training for the first time, October 1st, where we had 50 officers signed up. So this is not, we're not exhausting people's interest in this. We seem to be piquing it and drawing people into this because people care about this. Officers really want to create safe environments out there on the street. And so learning how to do safe enforcement of pedestrian safety, traffic laws, and bicycle traffic safety laws it's been a huge part of what we're trying to get going here. In this case now in the Baltimore region, but we're doing this with people from out the state. And we do real life simulations. Here we have Dr. Kearns and myself being the decoys. Fortunately, we weren't hit that day. But anyway, so we're real pleased with how this has turned out. And when you couple that with these marketing, outreach education campaigns, you can end up with results like this.
No texting and crossing. Hey, big guy, you might be tall, but you're no match for that van. Exercise is great, but it only works if you're alive.
Signal Woman wants to keep you alive. You'll be seeing her a lot as part of the Look Alive campaign.
Encouraging and educating drivers and pedestrians to be smarter and safer when they're at crosswalks. And through law enforcement, we're going to partner regionally with targeted enforcement efforts to make sure that everybody's aware.
Thursday afternoon, Baltimore County Police were in Arbutus stopping cars.
We're doing a special crosswalk enforcement program right now, okay? And whenever someone comes up to a crosswalk like that in the state of Maryland, you as the driver have the obligation to come to a stop and let that person cross, okay?
The Maryland Department of Transportation says in 2018 there were 66 pedestrian fatalities in the Baltimore region, accounting for nearly 1/3 of the 223 total traffic fatalities. Lieutenant Steve Sherber says drivers and pedestrians have to be on the lookout.
Pedestrians are walking in the roadway perhaps without looking for the cars coming in either direction. Unfortunately, they're wearing some darker clothing oftentimes, and they're hard to see. So when the cars are coming down the road, the drivers don't necessarily see them.
Lieutenant Sherber says put down distractions like your phone, look left and right, and use the crosswalk. Like Signal Woman says, we're all in this together.
Thank you for always stopping for pedestrians when they cross. Nice helmet.
You gotta love Signal Woman. Move over, Flo. Well, if you have any fines, those fines could go anywhere from $40 to $500. So look up, look alive. Reporting live, Lisa Robinson, WBAL, TV 11 News.
Great. Thanks, Michael. So where do we go from here with Signal Woman? Well, Signal Woman is bringing it on with more Signal people. And this is our latest campaign that we just launched a couple of weeks ago. We call it our Signal People Brigade. And essentially we have folks dressed sort of like Signal Woman who are out on the street, masked and social, but they stay social distance with these traveling backpacks on their back. And we're real excited about this campaign. It's already gotten some buzz going here in the Baltimore region. And these folks here, we have a series of messages that are on the backs, and these are basically backpacks that have LED lighting in them that light up like billboards, especially at nighttime. In the nighttime, it really is going to draw attention to the messages that we're having. So we're going to have these people out on the street. They don't have to interact because basically the messaging on these backpacks says it all. And that's an important message because we have learned in our pedestrian fatalities reviews that darkness is such a big factor. Visibility or lack of visibility is such a big factor in a lot of these crashes. And so that makes it so important that you be safe and be seen. And so we're going to make that a major emphasis in October as we head into the end of daylight savings time and go to standard time. Pretty soon it'll be getting dark at 5 o'clock at night. And so you can see that these backpacks and people walking around on the street are going to be able to draw attention to the messaging that we're trying to get across there. So we're very excited about this new chapter. And so with that, I want to end with the final video of the report that just came out last week. If you can start this, Michael.
No texting and crossing. Her name is Signal Woman, and her goal is to get people where they're going alive and unharmed.
A live and in-the-flesh character who brings the walk signal to life. She educates drivers, pedestrians, and cyclists, encouraging them to obey traffic laws and look out for each other.
On Thursday, a group of Signal people took to this high-traffic area in Dundalk to spread the word about the Look Alive campaign.
What we've been tasked to do, law enforcement, is train officers in the proper procedures to enforce pedestrian safety and pedestrian violations, along with driver violations.
This woman was excited to see this campaign because she's felt the pain of losing a loved one.
My father died in 2011 crossing the street, and he wasn't in a crosswalk. And he got hit by a car and killed.
Wait. And patience could save your life, especially in a heavily trafficked area like this. Baltimore County Police say that pedestrian-involved wrecks have gone up in the last 5 years, a number that could be trending downwards if pedestrians were using crosswalks more often and if drivers just paid a little bit more attention. The chances of a pedestrian surviving a crash with a vehicle are slim, and even slow speeds can cause injuries.
Always want to check your blind spots. Bicycling is a very popular activity in Maryland, and so you want to make sure you're checking your blind spots, especially before you turn, to make sure that there's no one there.
Now, there's a purpose behind the timing of this campaign. In the winter months, it gets darker earlier, so it makes it more difficult for drivers to see, especially when pedestrians are crossing the road. In Dundalk, Eddie Kadam, WMAR 2 News.
Okay. So what gives us hope that this may work is that we're hopeful that in Baltimore County, where we have been actively engaging in these campaigns now for over, a little over a year, we actually saw in 2019 a decline. The question is that that's not enough. We still had 22 people killed in Baltimore County. So we're going to be trying to drive these numbers lower, and through these programs that you just saw. So thanks so much, and really appreciate the time to talk with you all. And now I want to pass the baton and the presentation over to my colleague, Kandese Holford, who's been a principal shining light over at SHA and pulling together how we can do context-sensitive design standards in a way that will make the roadway safer for pedestrians, bicyclists, and the vulnerable road users. And she is implementing what Greg Slater talked about 2 years ago about needing to develop context-sensitive standards for SHA. And I'm so happy that Kandese is here to make that happen. So Kandese.
Good morning. Thank you, Jeff. I just want to make sure that everyone can see my screen. Would you be able to confirm, Michael?
Well, what we're seeing is your presenter notes screen. So you might want to change your screen.
How about this?
Nope. Duplicate slideshow, maybe?
How about
You need to select a screen in your in your webinar application under sharing.
Okay.
And where it says screen, it's a drop down.
Let's see. I see sharing. And
yes.
It says,
and then under show, there's a drop down menu.
Okay.
And you can select which screen your PowerPoint is now presenting on.
Got any better?
Almost, except your notes are sitting in front of the PowerPoint.
Okay, sorry.
You have to select the other one. Nope. Now we're seeing your presenter view. We're not seeing the slides.
I wonder if you'd be able to go through the slides for me, because I'm having a little trouble getting my slides.
There you go. Whatever you did, you're right there. Sorry to break in.
All right, thank you. I apologize for that, everyone. Good morning. My name is Kandese Holford. I am the regional planner for MDOT SHA's covering Montgomery and Frederick counties. I'm also the lead for the context guide and context-driven team. And so today I wanted to go over a little bit about how MDOT SHA is implementing Vision Zero and how we're progressing with our context-driven efforts. So the three things that I'll touch on are the strategic plan, the Vision Zero action plan that comes out of our strategic plan, and the context-driven initiatives linked to that Vision Zero action plan. MDOT SHA has been moving towards Vision Zero, particularly since the adoption of House Bill 885 in April 2019. And that bill established that Maryland is now a Vision Zero state. And SHA's strategic plan, Northbound, outlines 10 initiatives on which MDOT SHA should focus over the next 5 years. So that is currently in development, and one of those 10 Northbound initiatives is for MDOT SHA to implement a Vision Zero action plan. So how does context-driven fit into this picture? For MDOT, Vision Zero would be the umbrella under which a number of safety strategies are housed, and if Northbound is our guiding strategy, and Vision Zero is the goal, context-driven is how MDOT SHA has been, is, and will continue to fulfill this goal. And within context-driven, MDOT SHA is developing an interactive update to the context guide online, which you can see there on the screen, and as well as a suite of tools that we envision sort of as a context-driven wheel. And those, some of those tools are shown there on the right side of the slide. So here's the wheel. I'll briefly review the components of our context-driven wheel before diving a bit more into detail about how we and SHA are progressing and how you can get involved. First, MDOT SHA is developing its Pedestrian Safety Action Plan. I believe Jeff mentioned that earlier. We're referring to it as a PSAP, and I'll be doing that for the remainder of the presentation. The PSAP will identify needs in our transportation system and identify why, how, and where we should address those needs. So over the next 12 to 18 months, our team will be undertaking a process that includes research, analysis, benchmarking, as well as public engagement, eventually recommendations and prioritization of those recommendations. Phase 1, which includes data collection and creating a public engagement plan, is currently underway. So the PSAP will help us detail, as I mentioned, why, how, and where we need to implement the context-driven tools. And these tools include what you see on the right of the slide, 2, 3, and 4. They include the context guide, the context-driven toolkit, and eventually case studies. The fifth component of the context-driven wheel is education and outreach. Today's Walkinar included. Our practitioners at MDOT SHA, and we hope those at local partner agencies will help us build awareness and familiarity with the context-driven approach to infrastructure. They'll also be able to provide input along with all of our other customers as we develop and implement our PSAP. Sixth and last, we want this information to be easy to use, which means making it accessible. And so we're creating a one-stop shop online, a web portal that can be accessed by practitioners, by elected officials, and by the general public. So to better understand where to implement these improvements, and SHA needed to better understand the diverse context in Maryland. You already have seen the draft version 1.0 of the context guide, which came about September 2019. And so to do so, MDOT SHA is developing an interactive update to the guide to be a little bit more explicit and a little bit more allow more interaction between the public and these efforts and approaches that we're trying to implement. Our 2019 release of the context guide provided SHA staff and the public an online mapping tool. So you've got the guide and you've got an ArcGIS online map to understand these contexts. And then the guide also identified proactive treatments that will improve access, mobility, and safety for all users, but especially for pedestrians and bicyclists, who are some of the most vulnerable users on our network. So all of these treatments are treatments that will lead us to Vision Zero. And again, this is something that we sort of kickstarted last year, and now we're sort of looking to reinvigorate that process and introduce some new things that we've been working on. So as you know, the context guide, what it did was it re-emphasized the relationship between access, which is how many places you can get to, and mobility, how far you can go. Whereas in the past, transportation agencies may have viewed the relationship between access and mobility as sort of a standard one-size-fits-all. Now what the context guide tries to do is identify 6 contexts, give everyone a gradient ranging from rural to urban core that establishes what's actually appropriate in balancing access and mobility by context. As I mentioned, the context guide also identifies proactive treatments that will improve access, mobility, and safety. These treatments, speed limit reductions, roadway narrowing, road diets, improved lighting, pedestrian signals, and upgraded pedestrian crosswalks, coupled with enforcement, education, and EMS, will help us to meet our Vision Zero goals. So MDOT SHA has completed over 100 proactive safety projects in the last 18 or so months, first focusing on our urban centers and urban cores as sort of our immediate action plan. We're starting to track our progress and developing tools like this unpublished map that you see here. It's not finished or under development, but eventually we'll have things like this available for everyone to view in the future. And just to explain some of the data behind our approach, I borrowed these next few slides from our Office of Traffic and Safety. I thought it summarized our points made in the context guide and the draft context guide pretty well as our approach to future implementation. Understanding, of course, that data, which may, well, if we do this right, change over time. Compared with fatal non-motorist crashes, the overall non-motorist crash rate increases from 2 to 9% in urban cores and from 4 to 18% in urban centers. And based on our analysis, there are more chances for non-motorists involved in crashes in urban cores and urban centers compared with other context zones, in large part due to relatively small land area being defined as an urban context. However, if a crash occurred, the severity in urban areas is generally lower than in suburban and suburban activity center or traditional town center contexts, likely due to lower prevailing speeds and motorist expectation for pedestrian activity in urban contexts. So now that we've begun to implement new and innovative treatments, what comes next? Well, in the next year, we'll continue to advance the efforts that we saw on the context wheel. Right now, one of the primary focuses for our team is populating the context-driven toolkit. Some of these tools already exist and are being implemented, like continental crosswalk striping to improve visibility for all users on the road. And we're working to further build and populate that toolkit to provide practitioners a wide range of options so they're able to identify the right treatment for the right location based on the right context. In addition, we'll begin to conduct case studies. We've already introduced new treatments such as leading pedestrian intervals, as well as lowering speed limits in many corridors, with a special focus, as I mentioned, on urban centers and urban cores where we have more crashes, and transitioning to suburban activity centers where the crashes tend to be more severe. While we know the general benefits of these treatments, though, case studies allow us to take a more in-depth dive after we've had some performance data and establish the effectiveness of these treatments based on data-driven studies. So that might be one of the things you see a little bit later down the line, maybe next year, starting next year, probably late next year after some of these countermeasures we've implemented since 2019 start to really show performance data. We'll also be sharing and collaborating with our partner agencies to increase the visibility of the context-driven approach. We'll not only continue to educate our own workforce, but also engage the public. So over the next 12 to 18 months, we'll be doing this research analysis, benchmarking, public engagement, as I mentioned before, with phase 1 of that sort of just getting underway now. Over the next 3 to 6 months, you'll start to see more opportunities for engagement, as well as we flesh out and roll out our public input plan. And lastly, the web portal where everything will live. Information will be easy to use and accessible via an online web portal, which over time will incorporate models, maps, and various interactive tools, as well as presentations like what you're seeing today and presentations that we may have given in the past. We're creating, as I mentioned, a one-stop shop online where you can come and get all of this information, see our progress, see what we're doing, maps, models, all the fun stuff. So in summary, today we sort of went over how Vision Zero and Context Driven fit into MDOT SHA as an organization, as well as the steps that we're taking to strategically create guidance and tools to make Vision Zero a reality. MDOT SHA remains committed to improving and maintaining high quality, safe, and efficient roadways for each and every Marylander. So thank you for joining. Please, if you can, take some time to jot down my contact information. I can be reached at kholford@mdot.maryland.gov. But I also, my team has access to SHA Context Guide at mdot.maryland.gov as well. And I will hand it back to Michael.
Great. Thank you all for patience. We've been getting a number of questions here, and we have about 20 minutes or so to take those for you. And then anyone who wants to also add other questions, please add them to the questions tab, and we'll keep going till about 11 o'clock or so. And I see that our panelists have turned on their webcam, so you can see them during this portion. I'm going to start with a couple questions that we got, I think, from Jan Rutke from the town of Chesapeake Beach. And so she's curious about a couple of things. And the first one starts with a comment. And she says, my town of Chesapeake Beach has professionally drawn plans to increase walkability in our town. We are ready to apply grants. Who might be the point person I could contact if funds are available?
I think I might be able to answer that. Can you hear me?
Yes.
Hi. So in addition to working with the Context Guide team, I am a regional planner. I work in the Regional and Intermodal Planning Division at MDOT SHA. And my colleague, Christy Bernal, leads the Transportation Alternatives and Safe Routes to School program. She is the program manager, Christy Bernal, and you can also reach out to me directly and I can put you in touch with her for a status update on those programs and what might be available.
Let me add in that we're going to be doing outreach a number of years now. We've been involved with holding sessions either with the actual going out to actual areas and with district different SHA district offices and holding sessions talking about all the different grant opportunities. Kandese is, she mentioned Christy Burrell. We basically have grants for a fixed physical infrastructure And that's one of the programs. We have a series of programs that you can apply to. In the case of the Maryland Highway Safety Office, we give grants for educational efforts and for enforcement, and so we are able to basically issue those grants to police departments or to DOTs or planning offices that are doing outreach education, and we are very eager we are actually looking for people to apply for grants because we have money available through NHTSA, federal monies. And so even in these tough budgetary times, we're strongly encouraging people to apply for grants for pedestrian and bicycle safety in particular. That's my specialty. So anyway, so I would encourage you to, if you want to send your name to me or Kandese, we can put you in touch with the people that are organizing the outreach efforts. There'll probably be a large webinar event sort of like this in late January, beginning of February is usually when we do this. So, and Maryland Highway Safety Office grants have to be submitted by the beginning of March. And I think like the bike waste programs and the others, those usually, I think their deadline is a little bit later in the spring, but we talk about all that in that presentation. So yeah, we are really about building partnerships. So please get in touch with us and let's do this together.
Okay, thanks, Jeff. Actually, she had a kind of a follow-up question here that I'll read. We have 2 state roads that run through our. There's a long stretch of one of these roads with no crosswalks, including in front of an elementary school. In the past, the SHA has resisted our effort. The state's emphasis on walkability, and we expect more cooperation from SHA so we can traverse this road safely.
Agreed, understood. I definitely would love to get your information and sit down and figure out where we can be of assistance, we SHA. So I'm on the same page as you. And again, I'm K. Holford at MDOT.maryland.gov.
I know that I believe Chesapeake Beach is in District 5 and SHA District 5, right? So I think so. Yeah, and I know that they're doing a lot to trying to look at safety improvements to be made now. So there's been a lot of changes in SHA in the last 2 or 3 years. So let's work on it.
Dr. Alonge, did you want to say something? I don't know if you're muted. You are muted. Okay, go ahead. There's some issue with your audio. Are you self-muted, Dr. Alonge?
Yes, she is.
Okay, so we'll work on that with her. In the meantime, I guess for now we'll go on to the next question. It's also related to safe routes to schools. What efforts are being made to create routes to school programs in all counties, and how does one go about requesting a safe route for their children's school? It seems more sidewalks need to be built, more crossing guards hired.
With the Safe Routes to School program, and that's a good point. I mean, infrastructure is one component, but as we mentioned, there are sort of 4 E's to pedestrian and bicycle safety. So speaking only to the infrastructure component, our Safe Routes to School program has certain eligibility requirements, including a cash match requirement. And so I would love to go through those with you and see where we can actually get you some assistance and where the obstacles might be with regards to infrastructure improvements. But maybe Jeff can talk about other areas.
Yeah, and Kandese is right. There is a Safe Routes to School program that the state SHA administers, but I will tell you that Safe Routes to School is oftentimes a local issue because a lot of these schools may not even be on state roadways, and so I would encourage you to reach out to your county DOT that may be, they may have a program. I know in Montgomery County and I know in Prince George's County, they have pretty active programs to try to improve pathways, safety and pathways to the schools, and then to also work with the kids and the teachers and the principals in doing education outreach. And so there's probably a whole network that you could plug into through your local DOT. And this is the importance of the partnership, because they are partnered with SHA. Some of the grants that are administered, come from SHA funding, which is ultimately comes from the feds. So, but anyway, get in touch with your local DOT as well as with our Safe Routes to School group. Again, these are grants that are issued and will be talked about in that winter effort in January and February. So.
And I would also add that reaching out to your district office and knowing who your district engineer is and the assistant district engineer for traffic is usually a pretty good place to start as well. They're really plugged into our Office of Traffic and Safety, who sort of manages design requests for things like that if they're on a state road.
So, hi, are you able to hear me now?
Yes, go ahead.
Awesome, thank you. So what I was going to say, and I'm sorry I had to dial in again and I didn't hear the last question, but I wanted to speak to the first question. And my response will be that the Maryland Department of Health also does offer funds to local communities to do the Safe Route to School program. We currently have grants with the health departments in St. Mary's, Somerset, and Washington counties. And these are CDC funding that we receive, and part of what we're meant to do is this. And also, we also do have a disability grant from the CDC as well. And part of what we do is this is the walkability assessment in communities. So we encourage you to first reach out to your local health department, or you could also contact me via the email shown on the screen, and I'll be able to navigate you. But yes, the health department also supports this because we understand the importance of the built environment in health. Thank you.
Great, thank you. Okay, next question is, recently there's been an emphasis on part of transportation planning. How are you including this in your plans?
You kind of broke up there a little bit. I lost that opening. Can you?
Okay, I'll repeat it. Recently, there has been an emphasis on equity as part of transportation planning. How are you including this in your plan?
I can give that a start. It's a good question and something that I'm prepared to answer now because we're really just starting the process of developing goals and objectives for our pedestrian safety action plan. And we have, in doing this brainstorming right before we go out to the public and get some assistance from you all, we've really identified equity as a very important factor, something that should be woven into our goals and objectives. So that's definitely something that we're considering in developing our pedestrian safety action plan over the next year. And we're certainly looking for input from the public as to how we can do that best. So that we'll expect to see surveys and other online opportunities for you to give your input.
And we're, as I mentioned in our Maryland Highway Safety Office, we do a lot of work with data support, and this equity issue has emerged in this last year or so of being a very, very important. And we are, I believe that the current plan right now is we're going to be overlaying some of this crash data with demographics and land use, and that will enable us to help to provide input on the whole question of equity and where resources need to be applied. So.
And I just think that's great. And I just wanted to make a comment based on what Jeff said. I think the first part of being equitable is having data. There's no other way around it, because if you do not know what the demographics are, then how do you even make it equitable? So thank you for saying that. Thank you.
Thank you.
And I should probably re-emphasize that SHA works pretty closely with highway safety Jeff Dunckel is a veteran SHA person. I'm sure we collaborate with other business units under the state of Maryland, so MDH as well. And I think that having that communication line open and having this be a collaborative process really helps us meet those data needs and make sure that we're analyzing it to the best of our capabilities by using all our resources.
Okay, thank you. Next question here is, what types of criteria are looked at as part of the RSAs? What types of solutions are being implemented to reduce crashes in the targeted areas?
Okay. Kandese, you want to take that, or do you?
I think you mentioned, we have a history of doing pedestrian road safety audits, and that's something that SHA is really trying to restart again. But definitely highway safety has been monitoring that data, the historical data that we have, and we're looking for ways to refresh that. So I think having an accurate data set is important, and perhaps Jeff can speak as a veteran to how we've applied that in the past.
I like this term veteran. It sounds better than the old guy, but I do. I have done a lot of I've been involved with a number of the road safety audits, and I will tell you that it's a work in progress, because it can always be made better. The ones that I've been involved with have involved multidisciplinary teams that usually involve police, traffic engineers, pedestrian advocates, folks that might be involved with land use planning, planners that are aware of these issues and potential land use development. And the idea is that you basically take a stretch of road and you spend time observing it over different times of the day, essentially, so you're capturing all times a day over the course of usually several days, or maybe over a couple of weeks that you're doing these audits. And then in the process of doing that, what you're looking for are the vulnerabilities of based on the behaviors. What are people doing, and what is the infrastructure that's enabling some of those movements and conflicts to be happening? And the first thing to do is usually you come up with a list of maintenance-oriented improvements that can be done at relatively low cost, and simple things like trimming bushes that are obstructing, street lights, and identifying street lights that are out, and identifying places where there may be a lack of any kind of crossing or a sidewalk connection, those types of things. And so usually maintenance improvements are made fairly quickly. And then the engineering aspect, sometimes when you have to identify maybe a signal is needed, or some kind of a crossing opportunity that would involve a new type of a hawk signal or something like that. And so those usually have a longer lead time. They involve more money, so budget becomes an issue sometimes. But in the case in Montgomery County, we would partner with the state, and we usually split costs, and we would usually implement things in over about a 2-year period. And with engineering improvements. And so it usually involves sidewalks, crossing opportunities, lighting, other things too. And then also we identify education shortcomings where people may not be aware of the fact that they need to cross at the cross signals. And so we work with the police then and the education side, usually following engineering improvements that are made. But those are the types of things that we do. There's kind of a recipe, if you will, that has been developed. And I will say that many of the traffic engineers, especially in a lot of these district offices now, have really developed quite a list of treatments that can be done. But you always have to balance. There are issues with balancing that with the vehicular movements and all that. So it's as much art as science, I think, sometimes, though my engineering friends would call it science.
I would agree in that saying that it's as much of an art as a science, because while there's a recipe, and we sort of did them in a formulaic way, these road safety audits in the past, we're looking at how we can start to weave in our context-driven approach so that it's not so formulaic all the time, and we have a data-driven lens with which to look through to apply these equity factors and other things related to land use that tell the story more about the context. So our district offices are definitely doing speed studies and various other types of studies to assess and analyze the conditions of our roads and the infrastructure there. But we at headquarters are making sure that our district offices, that our access management and the developers that we work with are all in the loop on some of these context-driven treatments that we have populating the toolkit.
Great. Thank you. Do you all mind a few extra minutes since we have a lot more questions that have come in? Is that okay? Great.
Yeah, I'm just sitting at home. I got all day.
But we won't do that much extra time. Great. Next question is, what kind of analysis has been done about where crashes are taking place? For example, at intersections in the middle of the road where pedestrians should not be, and so on?
Yes, the short answer is a lot, right, Kandese? We're basically using crash data to try to identify where these crashes are occurring, and that got a little. I have a whole nother presentation that involves a lot of talk about trying to target efforts, based on geocoded crash data. But the reality, there's a little bit of sensitivity in terms of how much of that can be released in a public forum. So we worked very closely with our SHA colleagues in trying to produce reports that we can provide to local jurisdictions. And in fact, we've been recently doing that. We have made incredible progress. A little bit of backstory. In Montgomery County, we had a separate system where we were able to take all of our crash data, and with our own data analysis, we were able to map it and identify it. This is from way back in 2010. And as a result, we were able to come up with those targeted locations that you saw on that table that I presented to you all. And I was really a little surprised because that information was not as readily available at the state level initially when I first got here, and we weren't able to really share that information. That has all changed. There's been a huge step forward these last 2 or 3 years here now with trying to partner with our local jurisdictions and provide them with this crash location-specific crash data that is enabling them to identify where these crashes are occurring. Whether it be intersections or road sections where there might be a lot of pedestrian traffic but no crossing opportunity, those type of things. So we are entertaining requests from local jurisdictions. And we have a GIS system, geographic information system called Raven that we use to do the analysis, and we map this. And I know Kandese is very involved, that the SHA has really advanced this effort as well at their internal levels to do this context, to drive context-driven improvements. You need to have data that tells you where these things are occurring, and use that to help direct your efforts. So anyway, so the short answer is crash data we're using, and we're geocoding that and providing that as a guide to where we're trying to do these improvements and do the analysis on what needs to be improved.
And with these new changes, that are coming up in terms of information sharing, I think this is a great time for SHA to be developing a pedestrian safety action plan. But not only that, we're also trying to, we recently launched our long-term strategic plan, which includes the Vision Zero action plan as one of the 10 initiatives SHA is working on over the next year, and that will be a 5-year plan. Part of Vision Zero for SHA is learning what resources we have available and where all the data is. A lot of these offices have been working, to the best of their abilities to aggregate this data and then display it. And so it would be a really good opportunity for SHA now to get into the game and work with our Office of Traffic Safety and Highway Safety and all of these different offices to make sure that we can share the same information and maybe even have one place where you're getting the same data that you might be getting from an individual transportation business unit.
Okay, thank you. Next question here, kind of COVID related. Given COVID changes, including fewer rush hour driving commutes, more walking for exercise from home, less drinking in bars and so on, and recognizing that post-COVID, many COVID behavior changes won't go away, what impact do you expect or hope to see in safety data for these last 7 months? And will there be any lessons in that future changes to tweak our safety strategy?
Good question. Dr. Alonge, do you have any thoughts on that in terms of?
Yes, I was thinking I could speak a little bit to that, and that's a really valid question and a valid concern, right? With the onset of COVID and many people being indoors, we're concerned about people not even being able to move out and exercise and things of that nature. And from the Maryland Department of Health, a lot of what we've been doing, actually the communications department has been largely vested in COVID messaging. So I think social media is a large part of what we can do to combat this. And what they've been doing is putting out appropriate messages on the MDH Facebook and Twitter handles, talking about what people should be doing in the midst of COVID. Behavioral change is a whole, that's a great question. And behavioral change is something that really takes time. And now with the current state, with the phase we are as a state and the ability of people to move out, the messaging is around encouraging people to do that. I'm not sure we can do more about that. I think we'll look to see what the data says down the line. Yeah. So I think all I can speak to about that is that MDH is all about social messaging to encourage people to be more active. And of course, I think these other things around drinking and other behaviors are other things that we need to also concentrate on, because these are going to be real issues down the line. I'm not sure if that was helpful, but that's how I can tackle that. Yeah.
We just had some interesting reports presented to us a couple of days ago at the Washington Metropolitan Council of Governments Transportation Subcommittee, and also our data team in Maryland Highway Safety Office has been looking at sort of the post-COVID, the COVID period crash data. And what's interesting is we're finding, and this is disappointing to all of us in the traffic safety business, is that the numbers are not going down. We still have, in fact, in some cases, they're going up in some areas of vehicular crashes. So, my pedestrian numbers have not gone down as I had sort of hoped they might, when we were all walking and nobody was, driving for a while there. And what's interesting, though, is when you put that against vehicle miles traveled, that's actually, it looks like the crash rate has gone up quite a lot. But it's interesting because we don't really have good information about people walking. And so it could be that we just have a lot more people walking about, i.e. there's a lot more exposure. And so we were able to, benchmark that with actual people walking. It may actually, the rate might not have gone, may have gone down. But the point is, we do know that the numbers are not going down right now. And that's concerning, that we're looking for improvements, and it looks like COVID is not going to be the result of that, not going to cause that. So.
Thank you.
I do know that other, I apologize, MDOT, the Secretary's office is definitely looking into ways to start tracking our bicyclists and pedestrians a little bit more accurately and getting those numbers, seeing what different measures we can use, whether bicycle level of comfort or level of traffic stress might be something that we need to shift to. And I think you'll probably see some changes hopefully in the next year.
Okay, thanks, Kandese. We'll do a couple more and then we'll wrap up. Next one is, I see some towns have signs at walks that state that it's Maryland law to have stop for people in crosswalks. Are there any limitations to where we can put those signs? Is this law truly statewide, and can we get signs from SHA?
Signs that restrict, I'm sorry, what kind of signs?
To find people to stop crosswalks.
Yeah, I think they're referring to the paddles that we have that say, stop, state law, stop for pedestrians in crosswalks. Yeah, and then also they're up on the side as well, oftentimes at crosswalks. Yeah, as long as they're in compliance with the MUTCD, I guess it's fine.
I was going to say my best guess as a non-engineer is that it's based on what's in the law, the MUTCD.
I will say that a lot of those sidewalk locations are oftentimes in local jurisdictions, roadways, and so that would be the place you should probably start in requesting that, because the local highway, the DOTs are the ones that are essentially putting up the signage in those kinds of situations. SHA has those signs up on the state where they have them on state roads, but a lot of those are major arterials, and so. But again, as Kandese mentioned, that would be the district office that you would want to work with, and the district engineers, and we are putting that signage up. There was a period of time, I know, when we were trying to. I think there was an effort to try to reduce signage, and I think now with the emphasis on vulnerable road users and pedestrian bicycle safety, talking with your district SHA office would be a good place to go. But your local DOT would be a good starting point. So.
Okay, thank you. Question here: how can a lay person or partner get involved with these initiatives and help to promote public education?
I would say the local. Okay.
Go, please, Dr. Alonge.
Thank you. I would say start at your local level. In your community, start with your local leaders. Move it up to the local departments. Like I said, we as the Maryland Department of Health, we work a lot with the local health departments. I'm sure there are other partners. I'm sure transportation would have their own group of partners. So starting in the community, starting to work with the leaders in your community, escalating to your county level people would be the way to go. Don't aim for the state department of health. You can reach out. I'm just saying as an example of state offices. You can reach out to us and we might be able to navigate you to your local level officials or partners. There's so many resources in the community that you can start conversations with. And together, there are always opportunities. A lot of this work needs funding, but when you partner with those organizations, you're able to easily access that funding. So that would be my suggestion, to start locally and then fan out as you go. Thank you.
And as a millennial, I can just say that I encourage you to follow all the social media accounts that you can. I have a social media account strictly dedicated to all the transportation, local, state, municipal entities out there so that I can stay apprised of what's going on and I can respond to tweets. Sometimes people aren't comfortable, sending out a formal email, and sometimes things get a little bit more traction on social media. So use your resources and definitely start local, but don't be afraid to follow everyone you can on social media.
Yeah, I would say that the local your local jurisdictions they have a whole network of people working in those communities who are advocating and are very connected probably to the policymakers and the engineers that are involved in a lot of this. And I do know, like, for instance, speaking firsthand, because I live in Montgomery County, they are now redoing their 10-year plan for Vision Zero for the county, and they're going to be having a series of outreach events. Similarly, I think we have a lot of outreach that is being implemented in Prince George's County with their Vision Zero planning efforts. So it sort of depends on the local jurisdiction. And I would say that if you send me an email, I would be glad to connect you with some of the people in that your jurisdiction who are involved in implementing pedestrian bicycle safety, and people even that are activists and involved in participating in trying to do that. It's really about creating a network of people interconnected and knowing what we're doing to try to make things safer across the state. And so whatever we can do to try to get people who want to be participants and actively engaged in this, we want to network you with everybody. So yeah, so if you send me an email, and I'll try to connect you. So
great, thanks, Jeff. And thanks to everybody who sent all the questions. You can see that their emails are up on the screen right now, and we'll share the questions, all of them, with the panelists as well. So in the interest of time, I guess we'll kind of wrap here, but just wanted to give each of you an opportunity to give us some closing thoughts, and let's go in the order of the presenters. Just the final message you want to leave us with, Dr. Alonge.
So thank you so much, Michael. I'd like to really appreciate you, appreciate everyone once again for the opportunity to participate on this webinar. And so my final word really would be about, we've talked about it a lot, the fact that you cannot do work in silos, right? We should all collaborate as much as possible, engage partners. You're talking about equity, you're talking about health, you're talking about policy change, you're talking about environmental change, you're talking about the social determinants of health, which is a buzzword. We need to collaborate and work with partners in the community. So like Jeff said, I would say network, 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 and network. Thank you so much.
Thank you. And I just want to say that I was really pleased to be teamed with Dr. Alonge. Kandese and I are working a lot on the safety side of things, at the at MDOT. But the reality is that what underlies all this is health, and thinking that how important it is to be walking and stay active. I know as I spend most of my day now sitting in a dining room in front of a computer, I need to be getting out and walking a lot more, and as do we all, and that is such an important for the sense of well-being and staying healthy and preventing disease and all that. But that we need facilities in order to be able to do that. And I'm so excited right now to be working with MDOT and SHA and all the folks, the MTA, all the folks at MDOT are really, there's a new wind blowing about trying to create more pedestrian and bicycle friendly environments for people and for livable communities. And I think we are in a crossroads now with some great promise to be able to really make things safer out there and drive these numbers down in terms of fatalities and serious injury collisions, and get to zero. That's the goal. That's what we're shooting for. And by shooting for that, we're going to drive it down close to that. So it's very exciting, and I really appreciate being able to talk to you all about what we're trying to do and how we're trying to do it.
So thank you again, Jeff and Dr. Alonge, for having me on this panel with you and listening to me and sharing your ideas, and also with everyone else. I would say one thing that I've really learned working through this context-driven implementation and working with all of our partners is that there really should be an emphasis on the 4 E's, so engineering, enforcement, education, and emergency medical services. That is something that SHA takes seriously, and we really take advantage of our working relationship with all these other transportation business units to make sure that when we develop things like a pedestrian safety action plan, that it's comprehensive. It's not just focusing on how SHA used to do business, but looking at ways that we can collaborate to make our entire system better, and also just to consider the context around the roadway. So SHA really is changing the way that it does business, and I'm so happy to be a part of that as a newer employee, but really energized about this topic. So thank you all for attending. We had a pretty large crowd, and I'm so honored. If you have any questions, please feel free to reach out to me.
Okay. Thank you all. And with that, we'll conclude our webinar today, Pedestrian Infrastructure, Safety, and Health. I'd like to offer a great big thank you to our speakers for a great presentation, to everyone who attended, and to Francine Waters and Brittany Brothers of MDOT, who helped to pull all this together with us. The complete recording of today's webinar will be posted online, and our participants today will be sent an email with the link. When you exit from today's webinar, you'll be asked to participate in a short evaluation. Please take a few moments to provide feedback so that we can continue to improve the webinar experience for you. And please join us for the next 2 programs in the Walktober Walkinar series, New Trends and Technologies to Support Walkability and Walking, which will be next Thursday morning at 9:30 a.m. And the following Thursday will be the final one, which is Maryland Community Walk Initiatives, Walking the Walk of Maryland's Pedestrian Agenda. The links are available where you registered earlier on the web, and as well we'll be providing a blast out to all of the folks on our list. Have a great day.